Hi, everyone. Dr. Paul here from the Eastern Health Unit, once again with a weekly update. Today is June 8th, 2022. I'm going to share my screen with you as usual. I'm going to start with our local statistics, and you can see here that right now we're only at 3 hospitalizations and our positivity is down. So I'm just going to give you a bit of a sort of an update of our cases first, actually. If we're looking at our case numbers, again, we have a very good trend going downwards. We're quite low now in terms of where we are as compared to where we were in the middle of April and obviously during wave 5. If we look at one of the other things that I wanted to show you today was some of the data that we have that's comparative. So you can see this is all the Eastern Health Units, and you see we're sort of on the way down for those cases. But if you look at some of the other statistics here, you can see here, these are the cases here where sort of all the cases that we've had year to date type of thing. But I want to show you here in terms of the deaths, you can see that we have the highest rate of deaths across our eastern area, higher than Ottawa and Leeds Grenville. And if you're looking at deaths among 60 plus, again, we are actually among the first ones as well, and this is something that I've always feared and I always sort of was worried about, because we do know that we do have a higher rate of individuals who have underlying medical conditions. So again, if you could just go back to the confirmed cases per 100,000, we're actually just behind Kingston right now. We're ahead of Ottawa. If you look at non-long-term care cases, again, we're at number 2 here, but just to show you kind of the trends in the eastern area. And again, in terms of long-term care cases, we have the most in terms of the rates and among people over 60 plus. And so those are some of the statistics. But again, overall, we are seeing a decrease in that. And if we go back to some of our other measures locally, again, and again, speaking of institutional, looking at our outbreaks, they are going down. We're down to 6 right now. If you look at our hospitalizations, they too are going down. You could see sort of overall positive cases and then overall cases that are admitted for COVID. And we have none in the ICU right now and 3 only across our territory for COVID-related illness admissions. And our positivity, again, is on the way down. And you can see here that we've gone down. We're now below 7%, actually 6.4%, and that is very encouraging as well. If we look at our wastewater, that too is considered very stable in terms of where we are in terms of our wastewater plants. Castleman has gone up and down, but is much lower than it used to be. So again, overall, our wastewater is quite good, and we see the same trend provincially. If we start looking at vaccines that are being administered, I just wanted to show you a bit of another slide here. We're basically right now at in terms of people with a third dose, 57.3% of third dose here, and you can also see as well that 31.8% of our 60 plus population has received the 4th dose. And again, we still have some work to do for the 3rd dose, and this is again where we are there. If we're looking at the distribution by age group, you can see here that we're now at 55% of 80 plus. We're at 38.6% of 70 plus. This is the purple, which is 4th, and you can see the green pretty high, 60 and above. But again, the green is basically the 3rd dose, which is quite low. And again, I encourage people to go and get their 3rd doses. So overall, we are in the right direction. We are seeing it provincially as well. We're going to now brace ourselves for, prepare ourselves for, I think, a more pleasant summer. Again, we need to be careful. I know that the masking mandate has been removed, but again, as we said before, is recommended, particularly if you are in closed indoor spaces and have underlying illness or vulnerability, or if you have, if you're uncomfortable, etc. I know that the June 11th will mark the end of the mandates for institutions and long-term care. I do believe that the recommendation will continue, however, just to continue to protect those vulnerable populations. And again, we will be working between now and the end of the summer to prepare for what we would expect in the fall. The influenza has increased over the last month or so. That's not typical, but that's because we removed all the masking and all the other precautions that at the same time prevent respiratory illnesses as well. So now that those have been removed, we've seen of influenza, which will remind us that in the fall we need to get our flu shot because the flu is going to come back. It's already back now. It's going to get better over the summer, but it's going to come back in the fall. So we're looking at other boosters for COVID in the fall, looking at influenza shots, waiting for the 0 to 5 vaccination approval. And the other thing that we heard today was that Moderna now has another vaccine that has very good response against the Omicron variant as well. So that's something that we can look for, and that's a lot of us have been waiting for that to look at what other boosters would be available moving forward. So again, I think that we can't say we're out of the pandemic. I keep saying it over and over again, but the things that we can do is to continue hand washing and so on, and masking where appropriate, and at the same time, obviously, the third dose will really protect you more and for a longer period of time and make you less contagious particularly against Omicron variant. Right now, we're also doing surveillance and just checking to see if there's no variants. So far, so good. There's no new variants. We're just dealing with predominantly Omicron variants in the cases that we do have across the province. So that's a good thing. And before I stop, I just want to give you an update on the monkeypox virus. As you've heard, there's been more cases. There have been 8 confirmed cases in Ontario, none in our region. I just want to say that. We've had a couple of suspected cases, but they're negative. And so we're continuing to watch out for that. There has been a travel advisory for people just to be careful. Just to remind you that this is a virus that's related to the smallpox, and that it actually is transmitted skin-to-skin contact, close prolonged contact, respiratory contact, and contact with infected bedding and so on. So again, the risk is low, but we're still on the lookout, and we have our surveillance out for that, working with our partners in hospitals and healthcare organizations. So again, once again, thanks for all your cooperation. We do look forward to having a quieter summer, but still being careful and mindful that COVID is still there, creeping but at lower numbers, and so we should still be careful when appropriate. Thanks again. I'll talk to you next week.